So, Dr. Belmaker, you've expressed a lot of really important, crucial aspects of what is bipolar disorder and who gets it. Now, some people might be curious because there are two kinds of bipolar disorder, is my understanding, type 1 and 2. Could you speak to what that means and what's the significance of that for a patient and for their care?
Yeah, well, bipolar 1 disorder, as I think I did mention, involves manias that are so severe that they either require hospitalization or involve delusions where the person feels so excited and so manic that he might believe that he's the Messiah, or that he can fly, or that he has extraordinary sensory powers, or that he has caused severe damage to his family life or work life. Bipolar 2 manias are hypomanias. So there is elevated rate of speech and elevated mood and decreased need for sleep and a clear distinction from the normal personality to where there is interference in function but no need for hospitalization or severe disruption of work and family. So bipolar 2 disorder provides more of a diagnostic challenge, and we can more easily confused with someone who has a happy episode and who had previously had depressions. But sometimes a therapeutic trial is the thing to do, and to look at the effect of mood stabilizers and to whether they are helpful.
So it sounds like bipolar 1 is a much more severe mania, which can actually be dangerous to the person or other people. And that's really an emergency, bipolar 1, when they go into a manic episode.
Yes, and manic episodes that are severe are a medical emergency. They're not a situation where you'd want to make an appointment in 2 months' time. And we, of course, in psychiatry try to avoid hospitalization. But in bipolar mania, bipolar 1 mania, I personally think that we should make an exception. And I have a letter from a very, very famous Swiss psychiatrist named Bleuler, no longer alive, saying that psychiatrists make a great mistake if they delay in hospitalizing someone with mania who could damage his work and family. And as an outpatient psychiatrist with over 40 years of experience treating clinic patients with bipolar disorder and keeping people out of the hospital, I know that without a backup of a good hospital staff, when I need to send someone in the hospital, I can't fulfill my role as a clinic psychiatrist of keeping people out of the hospital. And so we do sometimes need hospitalization, and sometimes things are so severe that we need involuntary hospitalization if a person is directly dangerous to others or to themselves. And this isn't something that we psychiatrists do on our own decision. There has to be clear complaint of the family, clear corroborating evidence from the examination of the patient, and in most countries and states, the involvement of a legal or judicial impartial authority to whom we report the need for hospitalization. But it would be perhaps comforting if I could say that hospitalization is never necessary, but sometimes it is the right thing to do medically.